Hello dear respected students, welcome to our therapy number 1 Department of Kyrgyz-Russian-Slavic University. Today I am giving the basic methods of patient examination. This is our first lecture. Content of our lecture includes subject and task of propedeutics of internal disease, principles of clinical examination of a patient. Also, we'll study case history, general examination of a healthy person. Our therapy number 1 department, located in Fujuka Street, based on city hospital number 1. What is propedeutics? Propedeutics, from Greek translated, is an introduction to any science. For example, propedeutics of internal disease, it means preliminary introductory course preceding a deeper study of the internal disease. Three basic aspects make a sense of professional medical activity. They are diagnosis, treatment, prophylaxis. On the third course level, we will pay attention about the diagnosis. We will study how put the diagnosis, how prove the diagnosis. Fourth and fifth course level take you further into the treatment and prophylaxis of diseases. What is diagnosis? From Greek diagnosis, translated as a medical report on the pathological state, pregnancy, disease, and cause of death. There are two types of diagnosis: syndromic diagnosis and nosological diagnosis. Syndromic diagnosis is isolation of the main and concomitant symptoms. Main goal of propedeutic therapy is putting and finding out syndromal diagnosis. Example: bronchial obstructive syndrome, when our bronchi become to be narrow, or myocardial injury syndrome, or arterial hypertension syndrome. Next type is nosological diagnosis, highlighting the leading and concomitant disease. For example, bronchial asthma or myocardial infarction or angina pectoris, they are nosological diagnosis. There are three types of diagnosis: main diagnosis, complication of the main diagnosis, and concomitant diagnosis. The main diagnosis, the syndrome or disease which at moment are the main ones determining the prognosis of life or causing death. And complication, of course, this complication are really pathogenetically related or caused by the underlying disease. Example: bronchial asthma may have complication as respiratory failure, and concomitant diagnosis as syndrome or disease that are not pathogenetically associated with the underlying disease. For example, bronchial asthma, this is main diagnosis. Respiratory failure is complication of main diagnosis, and concomitant diagnosis is arterial hypertension or maybe myocardial infarction. They are not related with each other. There are two concepts: symptom and syndrome. Very important concept is symptom. Symptom is sign of disease or appearance of disease. There are two types of symptom: subjective symptom or objective symptom. Objective symptom detected by physician. Subjective symptom. Example, for example, is headache or chest pain. Physician couldn't detect or couldn't see patient's headache, couldn't see patient's chest pain. Objective symptom like edema or rash or for example increasing blood pressure, this is objective symptoms. What is syndrome? Syndrome, the set of symptoms which based on common pathogenesis, which based on common mechanisms of development. Examples of syndrome: bronchial obstructive syndrome, as you mentioned before, or maybe consolidation of lung tissue syndrome, or bronchial ectasis syndrome, or maybe hyperairness of lung tissue syndrome, and etc. To differentiate what is syndrome, what is disease and symptoms, I made for you this graph, and this graph demonstrates you disease, and as you see here, each disease can contain different kind of syndromes, and each syndrome consists of symptoms. Example: bronchial asthma, this is disease. Inside the bronchial asthma we have different kind of syndromes, like bronchial obstructive syndrome, when our bronchi become too narrow because of allergic process. Also, bronchial asthma has allergy syndrome. Also, bronchial asthma has respiratory failure syndrome. But this bronchial obstructive syndrome, which has different symptoms like cough, dyspnea, chest tightness, which grown by one mechanisms, may be part of different kind of disorders. For example, bronchial obstructive syndrome may be part of COPD with other syndromes, or bronchial obstructive syndrome may be part of heart failure, congestive heart failure, or bronchial obstructive syndrome may develop because of suppressing by enlarged chest lymph nodes, and etc. That's why bronchial asthma, this is disease, may consist of different syndromes, and each syndromes contain different kind of symptoms or set of symptoms. During our interaction with patient, we should always keep the morals and ethics, set of rules, medical ethics, medical deontology is set of rules which govern our behavior during interaction with our patient, and always we should pay attention about our behavior during interaction with patient. An occasional thoughtless word from the physician may impair the mood of patient, may impair his sleep, appetite, and general condition, even may provoke the disease. Not only occasional thoughtless word, even occasional wrong prescription of physician may provoke disease. These disorders which provoked by occasional prescription of doctor, because of doctor or because of physician, we call it as iatrogenic diseases. And during our interaction, always we should keep medical secrets, Case history is a main medical document which contains data about the progress of the disease from early manifestation till the present moment. The survey based on data of subjective and objective tests, main documents, and today we will study how interview the patient and which parameters we should put into this case history document. There are clinical steps of clinical approach. Of course, collecting the history of disease of patient, do examination, provide the investigation, and of course, last is management. There are two diagnostic methods, main and additional or accessory diagnostic methods. Main diagnostic methods include subjective and objective. And as you mentioned before, today we will focus on subjective methods, inquiry, analysis of taking history. Objective methods includes inspection, palpation, percussion, and auscultation. And after providing objective methods, we should prescribe the patient any lab test or instrumental test, sometimes genetical and experimental tests. What is palpation? Palpation as examination methods when you are, by touching the patient organs, take information about these organs. You can palpate the heart region, you can palpate lung region, you can palpate chest, you can palpate the abdominal region organs like liver, like spleen, and parts of GIT. Percussion. Physician striking, and during striking different organs give you different sounds, and during percussion you are recognizing sounds which produced in any kinds of organs. For example, if you percut the cardiac region, it will give you cardiac dullness. If you percut the muscles, it will be flat sound. If you percut the lungs, it will be resonant sound. Stomach and abdominal region give us timpani sound. These 4 to 5 weeks we will study healthy organism. After that, we will go further into the examination of respiratory disorders. Sometimes, instead of resonant sound, you can percut the dull sound. It will be in pathological condition, for example, in pneumonia condition. Sometimes, instead of resonant sound, you will percut timpani sound. This timpani sound, instead of resonant sound, can formated due to abscess formation, lung abscess formation. Auscultation also is very important examination. To auscultation we use equipment like stethoscope, and you can auscultate the valvular disorders, you can auscultate heart valves, you can auscultate breathing sounds, so you can auscultate abdominal region, you can take information about the functioning of viscera and vessels. Okay, let's go to the history taking. History taking is very important, and it should collect it very attentively. Hampton said that history taking was responsible for 82.5% of all diagnoses. There are parts of history taking or inquiry of patient or anamnesis. Latin name of inquiry is anamnesis. There are 4 types, 4 steps. First is passport part, pars officials, and patient complaints. History of the present illness, Latin name is anamnesis morbid, and life history, Latin name is anamnesis vitae. Of course, before asking patient about his passport part, you have to introduce yourself. First, who are you, on which position you are working. For example, hello, I am 3rd course student of general medicine department. My name is Harshita, for example, and then you start collecting passport part of patient. Passport part includes patient's name, his age, his sex, his residence, his phone, workplace, profession, position, time, and type of admission. And then you are going into the patient's complaints. Patient complaints, there are 3 types: main complaints, additional complaints, and general complaints. Each complaint needs to be detailed. What is main complaints? For example, main complaints for pneumonia, this is cough and increasing temperature. Main complaints for bronchitis, this is cough. Main complaints for angina pectoris, this is chest pain. Main complaint for arterial hypertension, this is headache. Additional complaint. For example, your patient has pneumonia, he has main complaint is a cough with production of sputum, and also he has constipation, which is not related with each other. It is that will be additional complaint. complaints. General complaints. Mostly general complaints represent of intoxication syndrome. This is malaise, weakness, insomnia, headache, decreased appetite. These general complaints may be present in many kind of disorders. For example, malaise, decreased appetite, weakness may present in flu, may present in myocardial infarction, may present in gastritis or in enterocolitis, and etc. Each complaint should be again detailed. How you make detailization of complaints? Of course, you should ask about the site. For example, pain, chest pain. You should ask site, where. This is local pain or diffuse. Onset, it was rapid or gradual, or maybe a pattern. And where is worse, where is better. Character of pain, for example, vertigo pain or sharp pain or stabbing pain or burning pain, for example. For myocardial infarction, character, stabbing and sharp pain. For angina, for example, character, burning pain. Radiation, radiation, where eradicate this pain, for example, eradicate to the left arm, to backside, to abdominal region. Elevating factors, time course, exacerbating factor, for example, this pain occurred during physical or emotional overloading. Severity of pain from 1 to 10, for example, mild pain or very severe pain. Associated symptoms, for example, pain may associated associated with dyspnea, or headache may associated with high fever, and etc. And you should also ask, does it interrupt life or not? If you are asking about pain, for example, here we have patient with chest pain, you should ask about exact site or location of pain, nature of pain, onset of pain, severity, and duration of pain. For example, several seconds or 5 to 10 minutes, character for angina pectoris. More than 1 hour, character for myocardial infarction. And also here we have different kinds of symptoms which character for different organs, systems. Cardiovascular system includes the chest pain, breathlessness, palpitation, edema. For example, digestive system has specific symptoms like decrease or increase appetite, thirst, difficulties of swallowing, nausea, vomiting, epigastric pain. For example, urinary system has also specific symptoms like pain, urination, and changing of urine character, and etc. After collecting the complaints and detailization of each complaints, main complaints, additional and general complaints, we are going further to collect the anamnesis morbid or history of the present disease. During collecting this part, you should pay attention about the time of the onset of disease, the character of the first symptoms, course of the disease, examination and their result, if any, treatment, if any, and its efficacy. During collecting history of present disease, you should ask about the onset of disease from the beginning. This is history from the beginning of disease till present moment. For example, here I drew for you acute bronchitis anamnesis morbid. At the beginning, patient has fever, and then in one day added sore throat and dry cough, and then he went to doctor and doctor prescribed paracetamol, and then in 5th day decreased appetite, weakness, and after 1 week added moist cough. This dry cough changed into the moist cough, and patient went to give analysis like blood test, which shows increased leukocytes level, increased ESR and C-reactive protein, and also was examined by chest X-ray, which shows the bronchitis, and after 10 days he came to us, day of admission. You see, and then with this more history of the present disease, you should ask from the beginning of disease till present moment. Also, you should ask about the provoking factor of first symptoms. Different kinds of disorders may different duration of analysis morbi. If here we have short analysis morbi, about more than 1 week, about 10 days, here we have more than half a year analysis morbi. Here analysis morbi of systemic connective tissue disease, dermatomyositis. You see fever started from September, myasthenia, myalgia, and in November added choking. Also patient has rash, which increase in November. Patient has dyspnea, which appear at the end of November, and hoarseness. And in December he was prescribed by prednisone. After using prednisone, his symptoms go down, but will keep in February till March myasthenia and fever. After collecting the anamnesis morbi, history of disease, you should go to collect anamnesis vita. This is history of life of patient. Anamnesis morbi started from detailization of social and personal history like birthplace and residence, race and migration if relevant, present occupation. It's very important because sometimes may develop occupational disorders. Level of education, smoking, if smoke, how long, type, if this is cigarette, pipe or chew, and how many per day, how many cigarettes per day. If use alcohol, do you drink, type of alcohol, how much, how often. If use drug, also type of drug, how much, how often. Social personal history includes also travel, where, how lived, when, their immunization, prophylactic status. It's very important. You see, lately we have COVID-19 distribution, and it's very important to collect the travel history also. Of course, you ask about the marital status. Are the household members pets if your patient has infection or has allergic reaction. You should detail the diet and physical activity of patients. Sometimes some disorders very connected with the particularities of diet or particularities of physical activity. Life history also includes past medical surgical history. Need to find out the patient's past illnesses, including injuries, operations, from childhood to the present moment, in chronological order. For example, our patient is 21 years old. When he was 3.5 years old, he got chickenpox. When he was 7 years old, he got acute tonsillitis. When he was 12 years old, he got appendectomy. At 16, he was diagnosed type 1 diabetes mellitus. At 17, he got pneumonia. And when he was 20 years old, he got TBI. This is past medical and surgical history of our 21 years old patient. Family history, very important, health of parents, siblings, children, because there are many hereditary predisposed disorders like cardiovascular disorders, like diabetes mellitus, like blood disorders, hemophilia. It's very important to get and detail the hereditary analysis. And allergological history, You should ask about any allergies, character of reaction, and allergens. May drug allergy, food allergy, biological, chemical, or physical allergy, and etc. According to allergological reaction, we have two types of patient population which belongs to the population A and population B. Population A patients don't have any allergic reactions. Population B, any allergic reactions. If your patient belongs to the population B, you should detail this is drug allergy, and you should put which kind of drug he has allergic reaction. For example, antibiotics or amoxicillin, penicillin, or maybe to, for example, to any kinds of food, maybe to biological products or chemical allergy. After collecting of analysis of patient, this is 4 parts, you should go to the physical examination of status present. Physical examination assessment started from assessing the mental status, posture, motor behavior, gait. Also, you are assessing constitution. Clinical provides a clinical anthropometry, assess sexual development of patient, and provide the thermometry of the body of patient. At the beginning, of course, you should assess facial expression. For example, stare, facial expression, character for hyperthyroidism, immobile face for character for Parkinsonism, sad face or depression may character for hypothyroidism, decrease eye contact may suggest anxiety, fear, or sadness. Also, you should assess the memory and attention of patient. Inquire about birthday, names of school attendant, jobs held, or past historical events. This is remote. Recent memory and attention. You assess by using questions like actual date, which day is it today, and etc. We have normally our patient has clear consciousness, clear mental state, because our patient orientated himself in surrounding condition, oriented himself in time, and oriented himself in place, time, orientation, not disturb, and of course he can say us and which condition he is right now. There are 3 types of consciousness, disturbance of consciousness: stupor, sopor, and coma. What is stupor? Patient cannot orient himself to the surrounding. He gives delayed answers. The state is characteristic of contusion and in some cases poisoning. This is stupor. For example, you are asking patient about something, he couldn't answer on time, and his answer delaying, and he's answering very slow. Sopor condition. This is an usually deep sleep from which the patient recovers only for short period of the time when called loudly or roused by an external stimulus. Reflexes are preserved. And 2, stupor and sopor condition, reflexes are preserved. Coma condition. This is a deep comatose state. This fully loss of consciousness condition may be coma condition developed due to diabetes mellitus, may develop due to brain stroke, may develop due to liver cirrhosis. In coma, we have absencing of reflexes. There is no viral function and there is no reflexes. Sometimes we are recognizing irritative disorders of consciousness There are, for example, hallucination and delirium. May sometimes develop other disorders like depression, apathy. And then you assessing posture or position of patients. There are three types of position and posture of patient: active, passive, and forced. Active, when patient by himself can change his position depending on circumstances. Passive position is observed with unconscious patients or in rare cases with extreme asthenia, when patient couldn't by himself change his position. Forced position or compelled position, often assumed by the patient to relieve or remove pain, cough, dyspnea. For example, sitting position relieves orthopnea. Dyspnea become less aggravating in cases with circulatory insufficiency. Forced position, here we have examples of forced position in acute epigastric pain. To relieve pain, our patient has to take this kind of position. And a tachybronchial asthma patient has to sit and take this position. He trying to open his mouth, he trying to open his chest, and he's fixing his extremities to opening the chest. This is forced position of patient with bronchial asthma. Constitutional types. There are three types. There are normosthenic, asthenic, and hypersthenic type. Normosthenic type is proportionally of a constitution. Asthenic type characterized by prevalence of the longitudinal size of a body, and hypersthenic type has prevalence of the cross-sized of the body. Here is normosthenic type. We have normal and proportional size of trunk and extremities, and also you see here is visible supraintraclavicular fossas. His shoulder size longer than bust size, and also his epigastric angle about 90 degree. And you here see asthenic type, when we have prevalence of longitudinal size, very long extremities, short trunk. Also we have narrow chest, narrow shoulder, and like narrow waist also, and epigastric angle, this about less than 90 degree. Here is hypersthenic type, where we have prevalence of cross size. We have very large shoulder, also large waist, chest like barrel chest, and flow of ribs has horizontal position, horizontal direction. Also you see epigastric angle more than 90 degree. Assessing of sexual development. Sexual development assessed by assessing distribution of hair shares into two types, men's and female type. The men's type is characterized by growth of long hair on face, beard and mustache, and also more rough hair on the chest and back and legs. Thermometry of a body, very important. Temperature may be measured in armpit, mouth or rectum, and normal temperature in armpit is from 16 up to 37 is considered as a normal. All have the patients the difference between morning and evening temperature as less 1 degree of Celsius. Temperature is in mouth changed from 35.8 in the morning up to 37.1 in the evening. Temperature in rectum on 0.5 till 1 degree is higher than in armpit, and also higher than in mouth. And also you should know, in middle of menstrual cycle, a woman have rise on 0.5 degrees Celsius body temperature. Here is differences between the Celsius and Fahrenheit temperature. Temperature curves. You have to measure temperature of patient in morning time and evening time and make graphs or curves. This is graphic representation of the temperature fluctuation during the daily measurement. There are 7 types of temperature curves: at constant fever, relapsing fever, intermittent fever, hectic, recurrent, undulating fever, or undulance, twisted fever. Temperature curves, there are 3 periods of fever: the initial period, stage height of the fever, and stage of temperature reduction. Different kinds of disorders, according to reactivity of our organism, give us different temperature curves. Examination of skin. During examination of skin, you should assess the character. You should characterize the skin. Of course, you should first check the color of skin, and sometimes maybe discoloration. Sometimes the patient give paleness, jaundice, redness, cyanosis. Paleness character for anemia, or jaundice character for liver cirrhosis. Redness may character for arterial hypertension, or an increase or increase red blood cells in blood. Cyanosis character for heart failure. After assessing the color of skin, you should assess moisture. Skin may be moist, dry, or oily. You should assess temperature. To assess the temperature, for judgment about temperature of the skin, touch the back surface of the finger. Temperature may be cool or warm, and texture, smooth or rough. Also, you should assess the mobility, the ease with which a fold of skin can be moved. This mobility may decrease in edema. Turgor, the speed with which the fold returns into the ply. Decreased turgor in dehydration. Turgor may increase in edema. Assessing of hair, examination of hair, also very important. Pay attention about the distribution of hair, quantity of hair, and their structure. And then you examine the nails. The nail plate in healthy people is smooth, colorless, and largely transparent, so it appears pink. Normal nail plates are slightly convex, which helps to protect the nail bed from impact. Sometimes you can recognize the brittle nails or reddish purple nails, yellow spots, pale nails. This is because of different disorders. After that, you should assess the hypotherm. Pay attention. Is the patient thin or well fat or obesity? Quantity of fat can be determined on thickness of the skin fold, which is usually measured in area of umbilical and the right subscapular area, and in area triceps of a right shoulder. Normal thickness of fold in umbilical area should be between the 1.5 till 1.5 centimeter. If it's more than 2, this your patient has predisposition to the obesity. Also, you should check the ideal circle of the waist should be not exceed 94 centimeters at men and 80 centimeters at women. Eyes examination in foreign medical practice, visual acuity and vision field are determined. Position and alignment of the eyes, eyebrows, eyelids. Eyebrows. Inspect the eyebrows, nothing their quantity, distribution, and any scaliness of the underlying skin. Eyelids. Know the position of the lid in relationship to the eyeballs. Inspect for edema, color, lesions, condition, and direction of the eyelash. Inspect the region of the criminal blood. Ask the patient to look up as you depress both lower lids with your thumbs, exposing the scleras and conjunctivas. Inspect the scleras and palpebral conjunctivas for color and note the blood vessels against the wild scleral background. Note features of cornea, irises, and pupils. Clinical anthropometry. Anthropometry includes the height, a measuring of height. Height above 190 cm is huge height, lower than 100 cm is Jewish height. Weight is necessary for satisfying the following conditions. The patient should be with an easy closed, without footwear, of course after a toilet on an empty stomach, mostly in morning. Here is BMI. Normal BMI index is between 18.5 to 25.9 kilograms per meter square. If we have less than 18.5, this we diagnose a deficiency of weight. If more than 25, this is overweight. Okay, I'm finishing my lecture. Thank you for your attention. Of course, our lecture will continue in future topics.